There's a number of features that we offer here at Moorfields. I think first and foremost is expertise that you may not necessarily guarantee to get elsewhere. All staff, for example, who work within Moorfields Private are also substantive consultants within Moorfields NHS. And that's the standard of care that gives patients the reassurance that the treatment that they're going to be receiving is of the very highest quality. The second is continuity of care. It'll be the same consultant that does the treatment. It'll be the same consultant that is responsible for their aftercare and follow-up consultation, so that every step of the journey they're seeing the same face and the same team. And perhaps the final advantage of coming to Moorfields is the reputation that we provide safe care, appropriate care, and ultimately the right advice. We have regularly patients booking in for second opinions. Examples may be patients who haven't had any procedure yet. They may have had a consultation elsewhere and they're looking to Moorfields for a sort of fresh input to see whether we give them the same advice that they got elsewhere. And in some cases the right advice is actually for the patient not to have any treatment at all. And that may be disappointing for them, but ultimately it's safe. Because of the Moorfields reputation, we also see probably more than our fair share of those patients with very unusual eyes, very unusual prescriptions, very high prescriptions, patients that have had surgery elsewhere and perhaps they haven't got the right result first time round. And so we're able to offer patients a sort of fresh look at the issues that they have if they've previously had problems elsewhere, and perhaps provide them with a solution or options to improve the situation. It would be quite unusual if a patient was contemplating any form of elective surgery not to have a certain degree of apprehension about it. And that's quite positive in a way, because it usually drives questions about, is the procedure safe? What are the risks? And one of the key responsibilities that we have as consultants is to make sure the patient is fully informed about the good and the bad. The three types of vision correction are laser eye surgery, refractive lens exchange, and implantable contact lenses. The facilities we have here at Moorfields Private are really second to none in terms of the equipment. So for example, the laser equipment we replace every 3 years. So to be able to stay up to date with the equipment enables us to stay at the forefront of the developments on the manufacturing side and to be able to offer patients the very latest in sort of precision laser instrumentation. There is a recognition both domestically and internationally that the quality of care that we provide and the research that we undertake is really of the very highest standard. And the benefit of that is not only just to patients in the past, but also patients walking through the door now, but also being part of the innovation of care as it improves in the future. And you don't necessarily get that in many other centres. Moorfields' reputation is certainly within the UK, and for patients who are making an elective decision where they may be apprehensive about their vision, to put their trust in us with the history that we have, I hope is the reassurance that they're looking for.
To find out how we can help you and to book an appointment, please call us on 0800 328 3421 or find us online at moorfields-private.co.uk.